Let me give you the inside scoop. Today we're at the Kaiser strike, and these health workers are fed up with being understaffed. Let's go see what's going on.
I'm a pharmacist. The worst part is short staffing. It's simply unsafe. Filling 100, 150, 200 prescriptions an hour by ourselves, putting speed as a condition upon us, it's unsafe. We need more staffing.
Kaiser's not really trying to work with what they're asking for, but with inflation and everything that's going on, we're just trying to catch up to the economy.
They want to give us a minimal pay raise when the cost of living around here is outrageous. I mean, there have been so many shifts where I've worked by myself for 8 hours and had zero help.
People are living in their cars because they can't afford to live in housing. They want to have billions and billions of dollars in excess funds but not pay their workers. They make them the money. They're a nonprofit. Why you keep them profit?
Instead of giving us full-time positions, they've replaced full-timers with part-timers to save money and on benefits and payroll and everything.
I don't really get a lunch. Let's start there. Okay, we get an hour lunch, but maybe we might get 20, 30 minutes, maybe.
This drama unfolds is ridiculous. It really is, because there's no need for it. They have plenty of funds to give people what they need to live. They're not asking for extra. They're not asking for any kind of craziness. UPS makes more.
We're happy with our jobs. We're just looking for a little bit better condition. I think that's the biggest misconception, that we all just want to quit, walk off. No, we love what we do. We just want to be compensated a little bit better to have a good life outside of work, and we want to be able to do our job safely.
How has understaffing affected you personally?
Some nights working from 6 to midnight. I'm the only pharmacist answering questions, solving insurance problems, going counseling patients.
I've had to say I'm going to close the pharmacy if you don't send me help.
Filling that many prescriptions in 1 hour with just one tech to help me. She's stuck at the window. I'm doing all other tasks. There's no check system. That's unsafe.
Because they don't think that having help is important or safe.
No one expects to have a perfect work day every day, but to know you're going into work hoping that people showed up today just so you could do the job, that just creates unnecessary stress. And then when you're at work and you're short-staffed, expect to do the job of 4 or 5 people, that again opens you up to errors, which again in medicine is very dangerous. So
Because if we don't have the staff, we have to pick up the slack. We have to do more work. And so while we're doing it, we sometimes even have to come in early. We have to finish our charts or do this because we were working so late the day before. So it's really one of those things that if we're on salary and we're getting paid, there's no overtime for us.
What do you want to see from Kaiser?
Raise pay. Inflation is way, way up. My grocery bill has almost doubled.
They keep insisting on these very low pay raises, and compared to California, the cost of living here is almost, if not more.
We want to see them raise the minimum wage, and we want to see more staffing.
when you have better wages, people are inclined to apply. When people apply, we'll have staff. So it all kind of is like a trickle-down effect.
What do you want to see from Kaiser?
I just want them to listen. The biggest thing is just listening to us. We're telling them.
What would you tell the CEO of Kaiser?
That they are putting profits over safety and over the patients and over us. They would prefer to line their pockets with their bonuses than to help us or to help their patients.
What would you tell the CEO of Kaiser if they were watching right now?
If you're making all that money, get in your nice car and come talk to us.
Go Kaiser! Help us, help us, help us. Thank you.